Bhavy Sri from 10th standard. First of all, the respected principal of the school M. Shekhar sir and correspondent of the school K. Anjanel sir and respected my dear brothers and sisters and teacher staff, all of you a pleasant good morning to all. Today my choice to express the topic. My topic name is healthcare challenges in India. India healthcare system faces a number of challenges including unequal access and infrastructure, a shortage of medical professionals and high pocket of expenses. These issues are mainly acute in the rural areas and the significance between the urban and rural areas. These are limited healthcare factors and many healthcare facilities are essential for the in the hospitals like beds, medicines, basic needs. These are all so essential and these are our main parts in the hospitals. And next, medical sectors. There are two types of sectors in medical field. One is private sector and another one is government sector. Now let me discuss about the private sector. The private sector means that the private healthcare sector refuse the services of healthcare and facilities, and these are all not controlled by the government, and this healthcare offers are sectors and technology, admission, technology and medicines are there in the private sector. And now let me discuss about the government sector. In the government sector, the total controlled by the government, and the government established some subsectors like PHC and CHC. The full form of CHC, community health centers, and PHD, primary health centers. Why they are established these sub-centers? Why? Because the poor peoples cannot get good and sufficient healthcare, so they are established these sub-centers. For example, the PhD centers, in every mandal they are presented PhD centers. Why? Because the poor peoples they have to get a good healthcare, and in the PhD centers there are free treatment and free medicine. We have to take we have to utilize these joints from the government, and the government are getting so much loss in these sub-centers, and also they are continuing these centers for the humans. And next, the COVID-19 pandemic. The India is the second largest affected country by the COVID-19. By the COVID-19, we caught the world caught so many people lost the lives, and we got so many losses in our humans' life. And next, by the COVID-19, every day 0.5 million people were dying, and every day 6.5 millions of cases are in 6.5 millions cases are registered, and COVID-19 pandemic time, so many workers worked so hard, including ASHA workers and doctors, nursing staff, etc. These all numbers are worked hardly in the hospitals and etc. The COVID-19 pandemic management are also vaccinated to the group peoples. In one day, they are vaccinated to the 1.3 millions of in one day on 21st January in the year of 2023. And next we discuss about the NCD. The full form of NCD is non-communicable diseases. By the NCD, so many people were risking to die by the lungs and heart diseases, strokes, cancer and diabetes. These are all includes to the NCD diseases. And next, by these diseases, so many people were died and there is no treatment to these diseases. And by the main factors of NCD, they are using tobacco and harmful alcohols, and there is no proper diet and lack of physical activities. So this why we are coming NCD diseases. Next, we have to discuss about the traditional methods. In the olden days, there are traditional methods and they are used as to treatment has and leaves, etc. There is no proper medicines in the olden days, so they are treatmented as in the traditional methods. And next, WHO also given permission to continue these traditional methods. The full form of WHO, World Health Organization. The World Health Organization also given permission to continue these methods still today. Why? Because there are so many profits in these traditional methods. For example, there is no proper health care to the lungs disease and heart disease and liver disease, etc. These kinds of problems in the natural method, they are curing to us, and that's why the health center, the World Health Center also getting help to these traditional methods. And in olden days, we are all see these methods. Now we have to say to the government, improve the education and improve the medical fields. Why? Because when education sector will develop, then healthcare sectors also develop, and we have to concentrate on the our health, how to take precautions while the weather changing. We have to maintain proper diet. We have to take sufficient food, and we have to drink boiled water, and we have to take when weather will change, and we have to eat vegetables and leafy vegetables, etc. We have to improve. When we improve our health, then we will stay healthily. Nowadays we are seeing so many people are believing these super sections. We don't believe these super sections. When we, for example, when we got fever, so many people are going to prayer gods and etc. We have to go to hospital. We don't go to pray the gods, etc. We have to go to hospital and get good treatment from the doctors. Doctors are the gods for us, not people, not babas and etc. They are not gods to us. When we get diseases, then we have to go to hospital. We can cure fastly. And at last, my conclusion is health is wealth. This quotation we can listen so many times. This quotation refers that health consists as a wealth. When we maintain good health, then we can achieve so many things and we get wealth also. So this quotation this quotation be like this, and we have to proper a good health. When we proper a good diet, and when we do exercise in our daily day-to-day life, then we proper a good health and good health, etc. And we have to improve our healthcare system, and we have to take nutrition food, and we have to For the nutrition food, the government started midday meals in the government schools, and in Anganwadis they have started boiled eggs. This types of nutrition food they are getting, and we also get nutrition food. When we get nutrition food, then we have to be healthy, and in rainy days we have to take care about our health, and mosquitoes are biting us. We have to avoid these biting mosquitoes. When the mosquitoes will bite, then we got some diseases like malaria, typhoid, etc. To avoid this, we have to clean our surroundings, and we have to improve green and clean. And thank you for giving this great opportunity to me, and thank you for all my dear friends and sisters and teacher staff.
Lovely.